Hi, I'm Dr. Regan Thomas, and I'm in the otolaryngology head and neck surgery department, and I'm professor of facial plastic and reconstructive surgery. Otolaryngology head and neck surgery is basically ear, nose, and throat surgery traditionally, but that includes a number of areas like head and neck cancer, sinus and voice and throat areas here, as well as pediatric otolaryngology, childhood problems, and other areas including hearing and problems with ears. And then my area is facial plastic surgery, which is a part of otolaryngology and has to do with both cosmetic things like facelifts and rhinoplasty and so on, as well as reconstructive areas after skin cancer or other aspects of facial reconstruction. Difficulty sometimes comes not only with the technical aspect, but also realizing that we're working in the face, and so there are lots of emotional sort of problems that patients have to deal with. So one area that recently we worked on is a young woman who unfortunately had a severe injury to her nose from a car accident, and although some of the structural components were still there, basically lost all the soft tissue of her nose. So you can imagine in a young person how awful that would be for anyone, but especially a young person who's dealing with new lifestyle things and social relationships and work and so on. So very challenging indeed, not only to get her back to a functional area, but for appearance as well. So on that patient we did what's called a paramedian forehead flap. Basically we are using the skin of the forehead and its blood supply at the eyebrow area and moving that skin down to where the nose had been and reconstructing the soft tissue and skin of the nose with that. It takes several stages, and after a number of weeks you can divide that flap and put the base of it back up, and now you have new skin and so on to really reconstruct a nose. It also required a few little extra cartilage areas that we took from a piece of cartilage from the rib and from the ear to help give the framework of the nose, but got her back where she felt comfortable, confident. So a challenging case technically, but also challenging to get this person back into a real life situation for her that really had a huge impact on her interaction with friends and relatives and work and so on. So a challenging case indeed, but one that we were very pleased that worked out very well for her. It's a wonderful feeling to see that self-confidence come back. So, we're hopefully getting a good result in terms of the surgical things that we do, but to also see that change in the patient's self-confidence and how they feel about themselves and how others are interacting with them, that's really a wonderful feeling and good to do. Patients should choose Northwestern Medicine for their treatment because, first of all of the newest and latest aspects of treatment are here and available. So it's upfront, in fact, a leader in most areas of medicine here, including our area of otolaryngology, head and neck surgery, and facial plastic surgery. So we should choose that, if we're the patient, about where do you go to get the best expertise, the best experience, and so on. That's coupled with, I think there's a lot of attention to patient comfort and the patient ability to feel welcomed and comfortable here in this what can often be a scary environment. And so I think we do a very good job at Northwestern for that, in addition to the appropriate treatment and the latest aspects of what's the best way to get you well.